So Uber, you're saying that there's sometimes challenges with triple trays. So what's wrong with this one?
So this is a regular triple tray impression. This is how the bite was taken, and this is the contact that we have on the teeth, how it bites together with the triple tray.
Right.
Then we investigate and we actually move it into the real position, and that is a completely different bite.
So that was. I mean, that was almost invisible for me to see. Like you just move that. Just how many microns? Like you just move that a hair.
That's over 300 microns, more than it's half a millimeter or even more. That is a remake because it won't. The bite will be so high it is unusable. Right. So this is the difference. This is the contact we were given.
Yeah.
And this is where the real contact is. I'll turn the model around it. It'll be a little bit more visible. So this is how the bite is.
Yeah.
And this is where it really is.
Wow, you had to shift that over a fair bit.
So when I let this go,
yeah,
it'll snap back in position.
Wow.
Right? So this is the amount of adjustment. If you look at it on the lingual here.
Yeah.
This is the amount of the adjustment the dentist has to make in
look
the
at
chair.
That.
Right? And this crown will not fit.
Yeah.
It'll be 1.5 millimeters too high. One thing to bear in mind, half a millimeter open bite on a posterior tooth means 3 millimeters, 4 millimeter open in the anterior. So this patient wouldn't be able to close his mouth.
Wow.
So that's the difference between. I can verify this with a bite registration. I can, because we do this all day long, so we knew there was a problem here, right?
So sometimes, we talked about this briefly, but sometimes before, when these dentists would send it to a different lab, like XYZ lab, some of the crowns come in and they fit all the time. Why is there a difference with what you're doing?
They don't really fit. They're just ground so low they don't have any contacts in the occlusal.
Ah, okay.
Right?
Okay.
They take it completely out of bite, so all the dentist has to do is seat the crown. If the margins are sealed and the contact is all right, and it's 1 millimeter out of bite.
Okay.
So they don't have any adjustments because the crown is not in contact.
Okay.
The usual way that triple tray impression gets taken, right?
Right. They bite right down to the occlusion.
They bite right down to the occlusion, and in a lot of cases, they bite through the impression material, which is a big problem for us.
Okay.
Right. The second thing that happens that there's nothing on this side to stop the patient from going into contact.
Okay.
And the patient will always try to find contact because he's got a mouthful of what his nerves, for want of a better word, think is food. There's something in the mouth, so they try to close all the way down.
Okay. Okay.
So if this is probably a bit thick, a thinner one would be just as fine. But if we put a bite stick in here,
yeah,
then this is the position that the patient bites in. We have sufficient material in the tray,
right,
and he can't bite any further down on this side.
Okay, so, but isn't that the concern that the dentist is going to have? Isn't a concern that it's an open bite?
The bite is open, but the centric relation is the proper relation.
Oh, okay, okay.
Because he's not trying to force this material out of the way. So here we have a stable bite. We end up with impression material that's thick enough, right? We need ideally 2 millimeters, but even 1 millimeter will do. If we go below 1 millimeter, that means to us that we can only pour this impression one time, and after that the impression is destroyed.
Okay.
We need to pour this 3 times.
Three times.
We need to have sufficient thickness of material to be able to, because the first model is the working model, the second model is a solid model where we adjust contact points. So if we don't have a second model, we can't adjust the contact points properly. So then the dentist will have to spend extra time chairside trying to fix the problem that the contact points may be too much or too little.
Because is there some guesswork there for if you can't, if you only can put, what happens if you can only pour a model up once?
Well, the contact point will be off because once the model is cut, there is, even the best model system in the world that we're using, there will be minute amount of movement in the dies on the model, and whenever you put the crown onto the model, it is possible that when the contact point is too strong, it will move the die over a couple of micromillimeters.
Okay.
Right? We're talking 100 micron, 150 micron. For the dentist, that means half an hour adjustment.
Right.
100 micron is half an hour adjustment.
Wow.
So we want a solid model where we know nothing can move. We adjust the contact points on a solid model.
Okay.
And the way we work here, we want to have a third pour, which is going to be our single die, so we can double check the margins.
Okay.
So in total, I want to pour this impression at least 3 times. And for
Okay.
that, I have to have a sufficient thickness of material. The moment it's too thin, it's going to rip the first time we pour it.
Okay.
That's as simple as it is. So then the next stage, this is why we want the dentist to take a bite registration. Once they can do it before they take the triple tray or after, but we have to have a separate bite registration. And what we do in the laboratory, we cut this down until all the interferences are gone,
Okay.
right? And then we seat this back onto the model until there is no flex in the bite registration.
Okay.
So it's basically a dead fit.
Okay.
I'll turn this around, you can see it from here, right? That there is a dead fit, that we know this is the way it bites together.
Okay.
And then the same with the opposing model. And that's how we check the bite. So once this is trimmed and this is fitted on the model, we close the articulator, and if that matches the bite registration, then we go ahead. If it doesn't match the bite registration, then we re-articulate it to match the bite registration.
Okay.
The triple tray is not an accurate bite registration.
Okay.
Never will be, because there's too much material in there. The patient deflects one way or the other because they got too much material in here. So.
Right. Right. Okay. So if the offices do the impression material like we just discussed, put the material in, use a bite stick, probably a smaller bite stick.
Bite stick or a leaf gauge, anything.
Yeah. Well, we another office I was chatting with, we grabbed one of the micro brushes, and it's a bit thinner than this.
The ones we use in the lab are a bit thicker because we don't go into patients' mouths.
Right, right. So then, if you could just close the model,
if you use a standard micro brush, it's a lot less than this one. But even a leaf gauge or anything you have, that's a millimeter thick, and we have them here in the laboratory. We have the plastic gauges, prep gauges, and all of that. Anything that's at least a millimeter thick, you can use.
Okay. And then from there, once you've done that, then all you would have to do is do a quick bite reg.
Yeah, this is the only way for us to verify that the bite registration is accurate.
Okay.
Now, what happens, and I'll try and explain it this way. What happens, because we only have this part, right? We only have a model that is this big.
Yep.
Right? We don't have the other side. We don't have a contact on this side that tells us when we are all the way closed down or if we're still open.
Right, right.
So what happens when you mount these without a bite registration and with you can get a deflection, and the worst case scenario is that your bite is canted like this.
Right, right.
So you're closed on one side and you're open on the other side.
Okay.
Right? And that leads to the fact that the lingual cusp on the uppers will be basically erased because they're in premature contact. So on this side we would end up with a crown that is too high, and we would end a crown that has completely wrong anatomy because we don't get the proper relation between the jaws, how it tilts which way.
Right.
We don't know that until we put the bite registration in.
Okay.
Right? Now with the bite registration, I will have this, and I can relate it like this.
Okay.
Right. It's the only way we can control if the bite is accurate.
So just to clarify and just to review, so when the dentists send in their models, we're going to use this triple tray. We're going to use this for the bite stick or a bite stick.
Yeah.
And if you then use a separate bite reg,
yeah.
What would you say the predictability of a crown would almost drop in compared to, say, some that would have to adjust? Is it a lot higher? Would you say?
Well, the more information we have, the more accurate we can make the models and the crowns.
So the
more information, which is the ideal situation, is a full arch tray. In a lot of cases, we can't do that, so we are going to the triple tray. With the triple tray, the only way we have to verify the triple tray is with a separate bite registration.
Okay.
If we don't have that, the chances for error are far greater than with a bite registration.
And you were saying only a few microns is almost half an hour in adjusting time. So to have an accurate fit is crucial for the whole process, because
we want the crowns to drop in. We don't want the dentist to have to adjust anything. And if if he has to adjust, we want him to maybe just have to take a diamond adjusting rubber to touch the contact points by a couple of micron. The margin fit of the crowns that we make is 25 to 35 micron, and that's a virtually invisible gap. 100 micron would be a gap that's visible to the eye. 150 micron is the size of a poppy seed. You know how irritated you are when you have a poppy seed stuck in your tooth. Now imagine a whole crown being by that much too high. It's unacceptable to the patient because the dentist will spend minimum half an hour adjusting that. So for us it is really important that we have to verify the triple tray. Right? And a model made of a triple tray that doesn't have a bite registration to verify it is going to be inaccurate by the nature of the way it's taken. So we need a bite registration to verify that the angulation of the models and the interdigitation of the teeth is exactly as it is with the bite registration. When those two match, we are guaranteed to have a crown that will go in without problems.
Ah, that's fantastic.